The state is also reporting more than 1,400 patients in the hospital with COVID-19. News 19's Jacob Reynolds has a closer look at how hospitals are preparing for more COVID patients.
President and CEO of Lexington Medical Center Todd Augsburger told West Columbia Council this week they've seen a major increase of COVID-19 diagnoses in recent weeks.
Here at the hospital, since we started, we've diagnosed 1,500 of those 2,500 cases. 615 in the last 2 weeks. Roughly 40% of our cases have come in the last 2 weeks.
Augsburger says Lexington Medical Center currently is treating 64 COVID-19 patients. The hospital's capacity is 508 beds, with the ability to add 100 more depending on staffing. But he says they can't all be used for COVID.
I am concerned about our ability to not only care for COVID patients, but what people also need to recognize is other illnesses have not taken a vacation during the COVID pandemic. We still are diagnosing the same number of cancers, of heart attacks, of strokes. People still need back surgery. They still need knee surgery. They still have emergencies. They still get in car accidents. So we're trying to provide care to all the people that we would have before. And we are seeing as much other illness as we had before. In fact, a little more as people delayed care during the month of April.
DHEC says the state's currently using 75% of its hospital beds, with Richland County at 78% and Lexington County at 85%. In late June, South Carolina National Guard Adjutant General Van McCarty said the state is ready to implement a hospital surge plan if capacity goes above 80%, but there are ways to avoid it.
There are mechanisms internally that the hospitals can and would do to reduce the amount of current usage, and that would be by maybe reducing elective surgery. So we will look at those type of mechanisms first to see how we can manage the hospital utilization need. Our priority and our preference would be to keep patients in a traditional hospital.
At the same press conference, the governor said he would suspend elective surgeries again if needed. In Columbia, Jacob Reynolds, News 19 WLTX.
MUSC in Charleston says that they have 101 COVID patients and capacity levels are at green, meaning they currently can handle the number of cases.